Hello friends, thanks for joining me again on Lybrate, and I hope that my previous videos have been very helpful to you for understanding your disease and for your personal education about your physical fitness. Today I am going to touch a very taboo topic, a topic which is always discussed under wraps, the topic of diabetes and impotence. Impotence is not about sterility. Sterility and impotence are two different things. Impotence is the inability of a partner to satisfy his partner on a sexual basis. Sterility is the difficulty in the ability of having reproduction. And that is a very important topic that I am going to discuss today about diabetes and impotence. Well, a lot of my patients of diabetes, they always have a query that, doctor, is diabetes going to affect my sex life? Well, my answer to you is yes. Diabetes is going to affect your sex life in not one but many ways. First of all, diabetes in itself is a problem that leads to nervous dysfunction. And in spite of getting stimulated, some people in diabetes in later stages who have got their diabetes uncontrolled for very long, they start to develop a problem by the name of erectile dysfunction. Erectile dysfunction is a problem in which after maximal stimulation, a man is not able to have a proper erection. And this problem actually comes up out of the nervous system problems that happen because of uncontrolled blood sugar levels. Well, don't get me wrong, I don't want to imply here that only diabetes is the reason because of which people develop erectile dysfunction, but diabetes is a very important reason because of which people develop erectile dysfunction. The second problem that people of diabetes may develop because they can have the effect on their sex life is about premature ejaculation. Premature ejaculation is the lack of stamina in continuing the sexual act and the culmination of the sexual act by ejaculation which is premature. And this means that a patient is not able to have a sexual satisfaction with his partner, and neither does the partner achieve complete sexual satisfaction because the male partner has ejaculated and there is no further stamina left for the continuation of the sexual act. I don't understand that these people who have these problems of erectile dysfunction and premature ejaculation, they are more concerned about the sexual factor affecting them rather than the diabetes that is affecting them. But they have to understand that the core problem is the uncontrolled blood sugar. If they are able to control their blood sugar, then probably they will be able to have a cure and a solution to both these problems. Also, the second thing that is very baffling to me is the fact that most of the people who are suffering from these kind of sexual problems, they go to quacks or people who are unqualified for the solution of their problems. Well, I believe that if you confide in your doctor and you go to a doctor who's qualified to handle this problem, then probably you will get a better solution and a better cure of your problem rather than going to somebody who's going to provide you some obscure desi medicine who doesn't even have the qualification to cure it. And in spite of that, the people are streaming to these unqualified people rather than the qualified doctors who may provide them a scientific solution to their problem. Having said that, I would also like to recommend you that you can also make use of the online consults that are available on Lybrate, which will help you to at least get a customized solution to your problem without having to go to people who are going to mess up your life because they do not themselves know that what they are going to give as a medicine to you. So don't go to those people who are not qualified. That's my humble submission to you, and I believe that you will enjoy a very healthy life ahead of you and try to understand that it is actually the control of blood sugar that is paramount in the control of your sex life. Thank you very much and thanks for joining in.